T-minus 1 minute. 10, 9.
We
8.
are recording. Yes.
Oh, didn't we learn that the Siri cannot do a countdown while it's already doing a timer?
It's Alexa. It was Alexa. It can't do a countdown at all.
So this is what we found on the web for you.
This is what we do.
What countdowns are.
We found out all this stuff is going on.
You could probably say timer to a 10-second timer.
Well, yeah, you can do timers, but I needed to count down 10, 9, 8. Yeah. So we are recording.
It's officially 1 o'clock.
We're going on. It is 1 o'clock. This is Gery L and Julie Barth.
Hello.
And we are doing a live stream version of our podcast today for the Old Nerd in the Gym. And if you're not seeing this live, then you're probably watching it after the fact. We will post the video.
Is it live or Memorex?
It's not Memorex. They don't do that anymore.
Are they out of business?
I don't know. That's tape for sure.
Does Memorex exist?
Memorex still does exist.
They're
yes.
buried next to Kodak.
Right. So we're here to talk about the coronavirus, the COVID-19 strain of the coronavirus, and what it means to caregivers. And we decided to do this as a live stream as well as a podcast. So we're going to have all of this available on our website afterward. This video will be available on the Facebook page, but it's also, there's an article already posted on oldnerdinthegym.com, and we will have this podcast will be posted up. We'll have it edited out and ready to go today. So it's not going to be one of those.
Apparently, it's going to be edited out and ready to go today.
It's going to be today.
Thank you for letting me know that.
Well, it doesn't need a lot of hype. I mean, we need to put the bumpers and stuff on, but this is important. We wanted to get it out.
You know
soon.
that regular people don't know what bumpers are.
It's the front and the back, the titles, like a movie has. So we're talking today about the coronavirus and what that has to do with caregiving. And I think it's affected an awful lot of people. It has here.
How to keep yourself and people you're taking care of safe.
Yes.
As much as possible.
And it starts with keeping yourself safe. So one of those things that you have to keep in mind, we're going to be all over the place with this. So if you have questions, throw your questions out there. If we don't get to them,
if I bring my phone up, I can see.
You can see the questions, right?
Do that.
So she's going to do that and keep an eye on it, and then we're going to be able to just go through this stuff and talk a little bit about how it affects you. We've got some resources to throw at you. There are already some on our website, and always go to the CDC for your primary information. Remember that they are the official piece of information, not only just from the government, and keep in mind whatever your politics is, the CDC is an independent agency. So it is pulling up scientific information. It's not throwing political nonsense out there. It's trying to help you to maintain your safety and security. We are here in Ohio, in case you don't know that. And last night, some heavy stuff came down from Governor DeWine, which was closing the restaurants at 9 o'clock last night indefinitely, except for carryouts and deliveries.
Well, if we rewind a little bit, Friday,
go ahead. Yeah.
Thursday afternoon, they closed the schools in Ohio. If you're not in Ohio, you might not know that.
A lot of other schools, New York did it today, I think, or late last night.
Yeah.
Either way, that's happening.
They gave us till Monday, but most of the schools in the area closed on Friday. So.
Well, why would you go one day on Monday?
Yeah, I think that's silly. So that didn't really make sense.
So they're effectively now we're freaking out about that, but treat this like a snowstorm. I mean, that's basically what I'm telling people.
Well, that explains the shopping habits of people.
It is a little bit. I mean, we are responding to this the way I grew up at a time when we had the 1978 blizzard I had to contend with. A lot of things happened during that time, and there was a lot of people. There were many people who were freaking out about all that. And even today, we still have that. You get a little bit of snow, everybody goes and buys up all the milk and the toilet paper in the store. Well, this is worse.
It's a little bit worse than that, yeah.
This is a little worse because you have the potential to get very, very sick. And I realize, and I want to address the media for just a minute because I do work in the media. We both do. And I work on television on occasion, and I will be doing a piece on this on TV this week as the guest expert.
Just as a note. This is me watching us.
It is a little weird. She's watching us. So there are interesting ways to understand how all this is working, and we'll be talking about that a little bit. But don't get too scared. Be thoughtful. Be prepared. But don't freak out. Don't go buy all the toilet paper.
Well,
I mean,
a lot of it is just common sense.
Anything
that you would do during a bad flu season.
Just do
that 3 times as much.
We're going to talk about that, but I think my primary concern is that people are watching, all these stories, and we had this happen this week. I had to send you for toilet paper.
I went on Thursday before the chaos ensued. So
And
we were able to find some.
we're okay. But, you know, I have my father at home. I'm watching him on a monitor right now because he's in a separate part of my property. So I'm watching him on a monitor. He's asleep. And even he at 87 years old, he's scared of this thing. He's fully aware. He doesn't have any dementia or anything. So he's asking me questions about this. And I need to point out, we are not medical experts by any stretch. We're not medical experts, not legal experts.
Just regular Joes.
We are regular
telling you
people.
what other smarter people have told
Yeah,
us.
we're trying to help you interpret this and to specifically for our caregivers and for the people out there who are just trying to stay healthy during this thing.
Yeah. So if we have any research, we'll post all that with this at the bottom of the videos and everything. I will put where we got our information. So.
Yeah, we're gonna put all these links up for you, so you'll have what I'm looking at right now on these monitors in front of me. If you can tell, I don't know how well you can see this, but there are two screens in front of me. Both of them are full of links that I have up, and I'm going to be pulling things from that. And I'd like to start with our own article. The piece I wrote yesterday and put out on the Old Nerd in the Gym website has more to do with just staying healthy during this thing. It's called Coronavirus and the Old Nerd, and it discusses essentially problems you're having to deal with, like protecting yourself, reducing your risk. And this is any viral respiratory infection. This isn't just coronavirus. If you do this stuff, if everybody did this stuff, the flu wouldn't be such a problem.
Yeah, if these everyday precautions were something that people did regularly, maybe that's something this will teach us.
I hope so.
To keep up with our everyday precautions on a better basis. Because you don't know how many times I've been in public and watched people leave a bathroom without washing their hands.
Oh, the guys are worse. The guys are worse. I
worse.
promise you. Guys,
gross.
if you're touching that urinal handle, sorry, dudes, you're touching this.
Imagine how many other
You're
people
touching the
have
last
flushed that
guy's,
today.
you know what? So you need to think about that. I don't think people pay attention to that part.
No, it's a right hand, left hand thing.
It doesn't matter.
No.
I'm telling you, they're going to do it with
It's
both
not
hands.
like a clean hand, dirty hand.
I don't think
like when
so.
you dip chicken and
Oh, is that
an
how it
egg
is?
hand, a dry hand, and a wet hand.
No, I don't think it works
Okay.
like that.
Well,
So,
I wouldn't know.
so something I want to point out as we're doing this sort of little summary before we get into some of the specifics here is broadview.org. It has a lot of information on spirituality, justice, all sorts of things. But they have a really great article that came out just this week about coronavirus comments expose a lot of ageism. It exposes things like when you say something like, and I'm going to read this verbatim, saying, quote, only, end quote, the elderly, ill, or disabled will die of COVID-19 devalues their lives. And that's absolutely true. It isn't just they who are going to die from this. It is they who are the most susceptible to this. And it's because of physiology. This isn't about ageism at that point. Now you're talking about the
No,
potential
it's just
for
a
them to get
matter
sick.
of the fact that their immune system is probably a little more compromised.
That's right. And if you have an immune deficiency, something like that, we have HIV people, we have people with autoimmune disorders, all this kind of stuff can cause a real problem.
Yeah, and a lot of people who have chronic disorders like lupus and such, that comes with a certain aspect of having an immune suppression.
Right. So let's dial this back now. We're going to talk a little bit about, I just want to mention some of the things that you can do to reduce your risk first. This is your risk. And I need to point out that you have to leave the house sometimes. If you're taking care of a family member,
You got to pick up prescriptions.
you gotta go to the store. You got to do all this. And I hope people who are not caregivers may see this and realize, or even somebody who doesn't have an elderly person or
even if you just have
an ill
kids.
person, even if you don't have kids, keep in mind that people need those supplies. Don't hoard this stuff because this is not a disaster. We're gonna recover from this. It's gonna take a little time.
Well, if you think about it, somebody probably, you don't need 7 things of toilet paper.
You really don't, but
6
somebody
other
might need one of
families
those. Yes.
could use that.
So imagine
You
how
keeping
this
them
is
in your
coming
garage
down.
is taking it away from other people.
Right. And if you are one of those, if you're a prepper or something, God love you because you got it
Yeah,
right.
you gotta
We were
love
all
those
crazy.
extreme couponers now
We
that
were
I used
nutty.
to hate when I worked in retail.
We were stupid.
They are the smart ones, maybe.
But you know
they're
what?
selling hand sanitizer for $20 a gallon.
The 75, no matter how much toilet paper you buy, it's not going to protect you from this bug. So let's talk about what will. So reducing your risk will reduce your family member, your charges risk.
Maybe I can guess what they are because I have.
You want to try to guess what they
I have some
are?
in front of me, and you have some in front of
Oh,
you.
we've got a whole bunch then.
So you do one, and
no,
I'll do
you
one?
do some.
Okay.
I'll cross them off
let's
as I
see.
go.
Avoid touching your face, nose, and hands.
Excellent.
Face, nose, and eyes. I don't know. Touch your
Specifically
hands,
with,
too.
and I should
With your hands.
with unwashed hands.
Yes.
If you just washed your hands, you're fine. But Yeah, don't touch your eyes or your nose or your mouth. Wash your hands often with soap and water, at least 20 seconds. People say happy birthday.
Any song is fine
Sing
as long
happy
as it's 20
birthday.
seconds.
Yeah.
ABCs is about 20 seconds. too.
ABC's Gilligan's Island will give you a full minute.
There you go.
That's cool. Any of that stuff, whatever you can do, Twinkle Twinkle Little Star, something that lets you remind yourself.
Keep in mind that it's friction that cleans your hands, not soap itself.
Yeah,
so
it's
just rinsing it.
Put the
Rinse.
soap, really rub it in.
Scrubbies.
So if you
Scrubby-dub.
here's what I would suggest you do. If you really want to see how to wash your hands, go watch an episode of MASH.
The surgeons?
The surgeons were taught, the
Up to
surgeon
their
actors
elbows?
were taught how to wash their hands by actual surgeons on the show. So you will be able to see them using not only scrubbing with brushes and everything, but they use a nail brush.
Yes.
Don't forget the nail brush on washing your hands because the amount of crap that's under
So
your nails.
Are
Think
nail
about.
brushes on the line with toilet paper where you can't get one?
I certainly hope not.
I have one already.
They're they're like $1, and
They
they're
are
often they're often in the travel area.
or with the nail polish.
Yep, you can find those. It doesn't have
Any
to.
dollar store may or may not have them, but I know that a lot of them carry them.
And any scrub brush will work.
Yeah.
Anything with a fine teeth or
You want
fine
something
bristles,
with a little bit of a
stiff bristles.
stiffness to
Yeah.
it, yes.
You got another one? Keep going.
I have clean and disinfect your home on a regular basis, especially frequently touched surfaces such as tables, doorknobs, light switches, toilets, sinks.
So we are not going to be
Handles.
that obsessive about this. We're just not because we're not wired that way. If you're scared of it already, you probably are this way a little bit. But
Or if you're already OCD and you do that. anyway.
doorknobs are the biggest one.
You don't have to do it 6 times.
And
just
guess
once.
what? You want to see? I don't have one here because I can't pick it up. But you're watching us on my iPhone. I saw a recent thing where they went in and they did swab studies on
Cell phones are gross.
in bathrooms. The cell phone was dirtier than the toilet in a men's room at an airport.
Think about it. Your hand touches your cell phone, 50, 60 times a day?
Oh, probably
And what is
more.
your hand
You're carrying it
touched?
around, right? So
My phone says I use it about 3 hours a day, according to my screen.
it's probably more than that
My
for
s-
most people.
Well, my screen summary tells me.
Yeah.
how
So
long
what
I'm
I'm going to
on my phone.
recommend is clean
Clean
that
your phone.
Take the case off, clean it up really well. Make sure you do whatever you need to do
They
for it.
had some kind of ultraviolet sanitizer. I don't think that's necessary.
It's forget it. Don't
Just
do the
wash your
ultraviolet
phone.
stuff
Get a
because
Lysol, wipe it down, let it
and
dry.
keep in mind ultraviolet is designed to kill bacteria, not viruses. I don't know if that's true for sure, but why test it? I mean, go look it up. Maybe there's something I'm not aware of, but I don't know how well that stuff works. The only way you can be certain is with an actual disinfecting cleanser of some kind.
So
Go
what
ahead.
else you got?
Oh, you
That
want-
was mine.
Oh, that was
turn
yours?
now. Volley to you.
If you feel like you're sick, stay away from people.
Yes.
That's when you wear the mask. You don't need masks if you're
Keep
not
your
sick.
ew
It
from
won't
other
help
people.
you. Yeah, it's to keep you if you accidentally cough or sneeze or something and it doesn't go anywhere. That's the idea. And throw that mask away if you do that. Don't keep it. Masks don't help you that much. The best thing to do is just stay clear of everybody. Now, as a caregiver, I have to put a caveat on that.
Well, you have to get close to your.
What do you do if you are sick or you're showing symptoms and you are a caregiver? Because if you have an elderly parent
Well, it
or
depends
patient
on
like
whether
I
you
have,
have another option.
exactly. So here's what has to happen. I'm hearing this from all over the place, different ways. Wash constantly and use gloves if you have to touch the patient's things or their personal. And you know, if you're moving their things around, you're getting them food, you're doing whatever. That's when you want to cover your mouth, cover your hands, wash repeatedly. You're not going to feel like helping them. This is going to be even harder. You're just going to be sick.
Well, and try to stay away from them as much as you can.
You just
limit how much contact. You
try
can
to ask
have.
for help. Come up with a contingency before somebody gets sick. I'm
Right,
trying to do that now.
If you have a second string to call in, that would be great. Some people are not going to have that
We
option.
don't have that a lot around here, so it's going to be
Get
rough.
yourself a beekeeper outfit.
Well, the
and keep
beekeeper
track
outfit
of-
won't help you. You have to have a hazmat outfit, fully
Beekeeper's
sealed.
not.
No, beekeepers' outfits are not sealed from bacteria and
Well, that's
viruses.
just a screen.
It's just a bug that can't get in. Go ahead. You got another one over there?
Avoid any non-essential travel and being in public places. We already kind of said that.
Yeah.
If you don't have to go out, maybe you can get the prescriptions delivered. Maybe wipe them down at the front door when they get here. But avoid packages. coming to your house?
Yes,
You
when
don't
we
wanna
got a
bring
package.
extra germs?
I was just telling Julie before we started, we got a package yesterday and wiped it down before we handled it with our bare hands and then washed after we did that. Once it
And
was out of its
took-
container,
The box only stayed in the house, what, 30 seconds?
oh, if that long, and it was on a tile floor where it could be wiped up really easily and didn't make it to the kitchen, didn't get around our
Everything was
patient.
disinfected and then
Yeah.
washed hands. And
Be sure you cover your mouth and nose with a tissue or something you can throw away when you sneeze or cough.
yeah, unfortunately, hankies are not exactly sanitary.
No, and I'm a handkerchief person, so I've had to.
You are old school like
I'm
that.
very old school like that, so I've had to kind of change my ways of doing that. But now you run into the problem of they don't have any tissues at the store,
Right.
so
Well, if you're going to be a handkerchief person, be a 7 handkerchief person.
yeah,
for the day.
change it every time you have a problem. But if you do that, throw the tissue away, wash your hands really well, make sure you're clean after you do that. Because now I'm seeing on TV people are doing this.
Well, then your
into the
arm's gonna
sleeve.
touch things.
Well, it is better than nothing.
Yes.
So what I was going
It's
to
better
say
in your
was,
hand.
if you don't have it, don't do it in your hands. Do it in your elbow,
Right.
like in
Well,
your
you
clothes.
can change your shirt. If
You can change your shirt if you have to, and it's not gonna. There's a thing about
You
surfaces.
don't usually rub your arm up against people.
No, not general. Well, now you're doing the elbow bump. You know, you're not supposed to shake hands anymore. We've been told, but I prefer
I'm not
this
going
one.
outside at all. So.
Do this. Do the Vulcan greeting from Star
I'm
Trek.
gonna do the I'm deaf and I'm clapping at something. Then
Yay,
across the
we're
room. Hi,
applauding?
nice to see
Okay,
you.
how you doing?
Yeah.
That's okay too.
That's
They've got
across
it.
the room.
They're gonna be safe. That's all I have on this
Well,
list.
live long and prosper is actually pretty good
It
advice
is.
right
It's a
now.
nice thing to say too, because you really got to do it. Go ahead.
What else have you got?
That's all I have on this side. This is a lot of not.
Wash your hands after touching surfaces in public places.
Oh, especially public places.
Mm-hmm.
Here's another one. 6 feet of somebody. Stay with
Yes.
away at least 6 feet. We're
I-
finding out that that's not
No.
enough.
I heard out this morning that they're limiting the amount of seats they're selling in the movie theater so people can sit every
6
other
feet
row.
apart. Yep. So they're not in the.
I'm
in the
surprised
same
they're
row.
not closed yet. But
That may
the
come.
library's closed.
That may come. Well, think about what a
Schools are
library is,
closed.
though.
Everybody touches the
Everybody's touching everything. You're
That's
sharing all the stuff.
And
so
there's a bunch of little toddlers running around playing
Little
with
kids,
Legos, putting them
yeah.
in their mouth.
you got daycares have issues.
Thank you, Amazon, for having downloadable books. Otherwise,
We
3
would
weeks
really
at home
be-
with my kid.
That's
my
gonna be
God.
fun.
Thank you,
Um,
YouTube, for existing.
The sneezes, respiratory droplets is where coronavirus is transmitted. So it's the breathing and everything, and it can be on surfaces. But I read
Yeah.
this morning, and again, this is unqualified. I can't remember who put this out. I think it was CBS News, but it was something to do with we're making too big of a deal out of the surfaces
Right.
because it doesn't stay on there long
Well, they
enough.
keep changing their mind.
They really do.
Kinda
So
like,
my
are eggs good for you? Every other week.
it's
like,
different. I think they really don't know.
Yeah.
I think they're guessing in order to be on the safe side, and I also have a tendency to agree with being a little bit over the top on this.
Err on the side of caution at this
Yeah,
point, I would
'cause-
say is good.
People are stupid in a group.
So what would you say about all these kids are out of school? What if they want to go to each other's house to play?
Absolutely not.
No.
No, they
What
got video
What if
games.
they're
They
all
got the internet.
What if they're all healthy?
How
don't
long
know
are they
where
going to
that
be?
kid's
You
gonna
don't know where
be.
the kid's been, and you don't know where their parents have been. You don't know
Well-
where their stuff has been. You
Right.
can't take that chance.
My kid's one of his best friends, his mom works at McDonald's. Imagine how many people she comes into contact with.
Well,
in a
that's
day.
no different than any place else.
I'm
And I
just saying.
think we
That's
have
food
a
related.
it's food related. You definitely want to be careful
Yeah.
about that. But again, this is a viral respiratory infection. It is
Right.
not something that you can get just from touching the other person. There has to be stuff there.
Right.
But why would you take that chance? You know, it's this is a lot of problems here.
So maybe we should go through the symptoms of coronavirus.
Do you
while
have
we're here.
those?
Yes.
I don't have those.
Potential symptoms include fever, cough, shortness of breath, persistent pain or pressure in your chest,
Sure sounds like the flu to me.
except there are differences.
What are the differences?
Well, that's a different piece of paper I don't have in front of me just
Well,
yet.
CDC, the
But
one
I
thing
can
that
tell you in a minute.
I did post repost a thing on the Old Nerd Facebook page
Yes.
that was a graphic that the CDC put out that shows that the primary thing that makes you sure that you don't have this is if you're sneezing.
Yes.
There's no sneeze, so apparently sneezing is not associated with this. I don't
Sneezing
really
is a good
understand
thing
that, but
right now.
yeah. So if you're doing that,
I,
go ahead.
I looked at a map the other day, which was interesting because it had how many cases in each country.
That map is changing by the minute.
Yes, this was from the 12th, and I have since seen a map that's closer to that. And they are changing at a rapid rate. But I think that also has to do with testing.
I am looking at, I will post this link, but johnahartford.org, the John Hartford Foundation. One of the articles that they have posted here is resources for older adults, family caregivers, and healthcare providers. I think this is a really good one. It's probably my favorite one I've read on here so far. It has things for prevention. It has who's more at risk. I think we know who's at risk. It's the same people who are at risk for lots of other respiratory illnesses. I don't think that's going to change.
Anyone with a compromised immune system.
And we've been over that, right? So now the thing I will add to that is that understanding what this bug is and why people are freaking out, you have to go back to the Spanish flu in the early 1900s, probably around 1917, 1920. I forget exactly. I don't have it in front of me. The Spanish flu spread like wildfire, and there was one city that did not cancel. It was about the same time of year too, and one city did not cancel their St. Patrick's Day event, and it spread crazily.
Yes.
It just went bananas.
And that's interesting because it's St. Patrick's Day tomorrow.
It's St. Patrick's Day.
I have heard that some places have not canceled their event.
That's nuts. If you're going to get into a crowd like that, you're asking for this. And
yeah,
I don't care. And I'm going to say this
I'm not someone who would go out for St. Patrick's Day anyway, but
I'm going to say this very
not worth it.
No, and I'm going to say this very directly, and I don't care if people don't like me. If that's what your focus is, that you need to go get drunk because it's St. Patrick's Day and you don't care about what's going on, you deserve what happens to you. But the problem is you're going to give it to somebody else.
Yeah, your kids are
I'm worried about your kids and your grandparents and your whoever because you're too dumb to stay away from these things. And if people don't like me for saying that, that's too bad. I do agree the government's gone kind of nutty on this a little bit, but they have to. Because what are you going to say to them when they don't go nutty?
Right.
And this thing turns into a bigger problem.
Everybody freaks out all of a sudden, and then
nobody wants to
they want somebody to blame.
Yeah, I'm always going to blame Trump for everything because I don't like him, and I don't have a problem saying that. But at the same time, I'm not listening to Trump. I'm listening to, and I wouldn't listen to whoever the president was at the time. I'm listening to the experts, the CDC, the doctors, and the people who are talking about this. Those are the ones. I don't want to hear from the news people. I want them to tell me where to find my resources, which is what we're doing here for you. We are not experts.
Yes.
We're helping you find these resources.
I was listening to our local NPR station yesterday, and I found out that the former head of, Surgeon General, the former Surgeon General was going around to hospitals, including the ones in the most affected areas in California and Washington, to see how prepared they are. And they were saying all of the things that we've been saying to try to limit the hospitals being inundated with people who aren't.
If you're not sick, don't go to the hospital.
Yes, I am planning to reschedule a doctor's appointment for blood work next week because it doesn't matter. It's not that important.
Well, yeah, if you're not sick, don't go. I think that's a huge thing. If you're not
ill. My doctor's office happens to be in a hospital. So.
And if you're not ill, please don't go to the emergency room. We have, where I live here, there's a very small ER. And it's a real ER. It's got a CAT scan machine. It's set up by one of the local healthcare giants, but it's a rural ER. It is designed. I think there's 15 or 18 rooms, but they don't have 15 or 18 doctors.
No.
And I can see them probably being busier right now. I don't know if that's true. It'd be interesting to find out.
That was one other thing that they mentioned was if the doctors are taking precautions because they can't get tested to find out if they're at risk because there aren't enough tests. Then they don't know if they're, they need to be sequestered, then we have less healthcare professionals to deal with the same amount of patients or more.
I think people forget that doctors are first responders.
Yeah.
And nurses. And I think nurses get this more than doctors because the doctor's with you for 12 seconds.
I can only imagine being an EMT right now, having to go into people's houses.
I would, well, and that brings me to another subject. So is any other things on those lines? Let's move on to the next thing here. So the next thing is about home care. So as a caregiver, we're talking again to a lot of caregivers, and as a caregiver, your likelihood of running into people who have to come into the house to care for your patient is very high. For the last few weeks, we've had therapists coming in for Dad, and this week, every day we have a home care person for a couple of hours who comes in and helps with lunch and cleaning and all that sort of stuff, and we greatly need her help. But the problem is that I don't know where else she has been today. I don't know if she has taken those precautions. And now I should say this, she and I have talked about this, and she is doing all the stuff that you should do. But there are people who may not.
Right.
Or you just don't remember. You
or if it's just DoorDash and you don't have you don't know where that person's been. Like you
Well,
said.
here's the other, yeah, and along with that are people that come into your house that your plumbing breaks down. You have to have a plumber in your house. You
Right.
don't know where he's been. I mean,
what about even just the mailman? You're not interacting with them, but they've touched all your stuff.
this all sounds ridiculous when you put
It's
it on
getting a
paper.
little crazy,
It
I know,
feels scary. And I had a weird. I'm going to talk about this for a minute because I think healthcare is
You have a weird dream.
about talking about your dreams. I had a weird
It's
dream
very Freudian.
that this was very much a Twilight Zone episode.
It does feel like.
And
one,
it was the
doesn't
one where the people, I don't know if you've ever seen the Twilight Zone. There was an old episode where the people are running around. This guy's going, "Where'd everybody go?" And they used it in an Arby's commercial.
Arby's
once, I
roast
think.
beef sale. I remember
Yeah.
that.
So this is a.
It's like the
I think they
Birds,
redid
where
it in
all
the
just
movie
running
too.
around. Kind of like an Alfred Hitchcock, The Birds.
Very
People are
much an
running around
Alfred Hitchcock
crazy.
kind of thing. And I woke up thinking like, and there was an issue with it. I was thinking about how the government feels like a nationalist government right now.
Mm-hmm.
We're gonna militarize. We're gonna military law. We're gonna do
A
whatever.
little bit communist around here.
Well, less communist, more Nazi. But this is, and people are freaking out. This is what socialism is like. Well,
I
if
don't
socialism's
know.
going to keep us alive,
right?
it's not
I'm
that big a
okay.
deal. I've
Socialism's supposed to be everybody for the greater good.
now I
So
say
that's
that
not bad in theory.
it's not bad in theory. In practice, it has some issues. And one of those issues is, okay, we've closed all the restaurants, but there are so many people who work for those restaurants who are on very limited incomes and often depend on their tips.
Yeah.
And they're not going to be making money right
Yeah,
now.
and they're talking about loans for small businesses, not loans for people who have small
Who have to work
who have
there.
small bank accounts.
Well, and the idea is that the small business will be able to continue to pay some people and keep it going. So I'm hoping that will be a better issue.
The marker.
The marker. This is how she tells me how much time we have. And I'm hoping that will be a less of a problem. But continuing our discussion about older family members and having people come into your home, you have to do this with family as well.
Yes.
You need to let your family members know, hey, this is a risk. I don't know where you've been. My sister's been sick the last few days. She usually comes to see my dad on the weekends, and she's had some kind of an inner ear infection, and we just can't.
She's frequently ill.
She's frequently ill with this stuff, and this
she's
is
around large groups of people.
large groups of people, church, all that stuff. And she has self-quarantined from seeing him, which is good. She called and talked to him today. His sister, my father's sister, is very much the same way. She has trouble getting a ride, but she's been sick too. So we have all of these things that come into play here. We have to be careful that the boy doesn't bring something home.
Well, in my own family alone, I have a transplant patient, someone with an autoimmune disease, people over 2 people over 70.
So we're all screwed, is what's going on.
Teachers who are being 2 college professors who are around a bunch of people at one time.
At least that's college is a little bit easier because you're not right up against them.
That's true.
You
you
got
don't
some
have to
distance.
wipe their noses like a
No,
kindergarten
you don't have
teacher.
to. You're not a
hopefully.
daycare teacher or something. So
I do have the new numbers for how many cases in
let's
each
have it.
state if you're interested.
let's have it.
Ohio is still currently at 1 to 5 cases as of March 14th, but that was 2 days ago.
I heard there were 36
So
confirmed
this is
cases.
2 days ago.
Huh.
Situation 17. They didn't update it.
I don't think that's updated. We should probably check that out. You know what? And it doesn't matter. If there's one case that's anywhere near you, the potential of you getting it is a lot higher. So let's just.
Why not take precautions?
When the casinos close in Vegas, this is a serious problem.
Well, what is it? Vegas and Disney World and
They-
Disneyland.
Disney-
and they only
the
last
Disney's-
time they closed was the Kennedy assassination and 9/11.
And that's look what it took.
Yeah.
You had to kill off the president and 3,000 people in order for Disney to shut down. And I'm not saying that tongue in cheek. That's a big deal.
This says as of CNN 57 minutes ago, 6,500 deaths worldwide.
There you go. That's worldwide.
That's worth,
6,500 out of 400,000.
6 million people on there. 6
Well,
billion.
I mean, 400,000 that
6 billion
have.
people on the earth.
I don't know what the numbers are. Let's not speculate. I don't want to be the guys on the news.
No, there's 6 billion people on Earth. I don't know. That's not a guess.
So here's the other thing to consider when you're doing things at home and taking care of the family member. This limits your exposure, do all that stuff. But the other thing we have to contend with is not just protecting yourself. The Washington State Department of Health has some stuff, and we posted that on the Facebook, or I'm sorry, on the website already. It's available. But here are some things we need to deal with. Isolation and monotony are going to be a problem. So now schools are closed.
Netflix.
Well, but the thing is, you have to keep in mind that when you're having Netflix and all these technological ways of maintaining, your sanity, but there are some things that I'm starting to feel a little stir crazy after several months of adjusting to dad living with me.
Right.
So think about that, and now think about the things that I did outside of the home that helped me with that are now closed.
Yes. Yoga.
I don't want to yoga classes, my workouts, swimming, all this. The gym is closed, and I don't want to go to a movie theater now. That scares the crap out of me. I don't want to be in those situations because I can't take the risk. So
and it's still winter, so you can't do things
it's
outside.
still winter. It's hard. Now it's up today. It's going to be in the 50s here in Ohio, but I don't know where everywhere else.
Potentially take a bike ride.
If you're in a better,
doesn't associate with other people.
If you're a better client, and you know, I'm going to encourage that. We're going to get to that in a minute. So one of the things is food. Let's start with how to deal with some of this stuff.
Well, I also had some stuff from the CDC.gov that said try to figure out a way to get food delivered to you so you don't have to go to the grocery store.
Okay.
Stay out of social, family, or commercial networks. Maybe have a friend bring some groceries to you if you're at risk.
So what is to keep, and I'm going to throw the wet blanket on this, what is to keep the friend from having the problem?
Well...
See,
but if they're not at risk, it's better they go to Myers than an 80-year-old.
Than you going and taking your charge with you, or your child who's ill or whatever. Right. The other thing about food is you have to be careful when you're isolated. Don't overeat. Ignoring the potential for supply shortages. Okay, take that out. If only to avoid the infection risk at the store. Boredom is going to invite snacking and potential overeating.
This is true.
You have to be careful about that. When you do shop and you get a chance to shop, avoid buying those unhealthy snacks. Try to get fresh fruit.
I will tell you what, the fresh fruit and vegetables was pretty hard to find. I went
They're
to the
getting
grocery
picked
store
over.
yesterday. There was nary a bag of salad to be found.
So I was told by a Walmart employee that directly, firsthand, that Walmart gets a truck. Every Walmart gets a truck every day.
Every day?
Every day.
A lot of them are 2 or 3 times a week.
Now, if it depends on what it is.
Yes.
So the basic stuff is delivered every day. Things they go through a lot. Milk,
what about the
all
fresh
that stuff.
produce?
The fresh produce is part of that, supposedly. Now, this could change. I don't know Walmart's, if it's the same across the board, but these Walmarts that this person was telling me about are part of that. But you've got to stay on top of it. Try your mom and pop stores.
Yes.
The local stores have stuff that the other ones don't.
Some of the smaller grocery chains.
Yes, they're still out of some of the staples. You're not going to find hand sanitizer. You're going to be low on toilet paper, all that stuff still. But again, take what you need. But citrus fruits and other fruit will help you shore up your immune system. Provide them to your family member as well if they're stable enough to eat it.
Is there anything about like echinacea, vitamin C?
You know what? Those things, those are anecdotal as it is. I don't want to push any kind of supplements because I don't think, honestly, my personal opinion, having a background in biology and the healthcare work that I've done, I've not seen a lot of difference in them. I think it's never a bad thing to shore up your vitamin, efficiency.
But you should be taking a multivitamin anyway.
A daily multivitamin is probably the best you can do because anything beyond that, all you're getting is expensive pee. I say that all the time because your body can only process so much. So if you start downing all this stuff, I'll never forget a friend of mine thought it was called euthanasia.
Echinacea?
I'm taking some euthanasia today. I'm like, no, I hope not.
You really don't want to do that.
But it's not gonna stop this. You can handfuls of vitamins all you want and all these weird food supplements, the network marketing supplements, all that stuff. It's not gonna stop it. You need to eat real food and you need to do it properly. The other thing is hydration.
Yes.
Drink the water, people. You've probably seen. We've got our old nerd jug
Water
here.
is safe.
Water is safe. If you get bottled water, you're probably not running out of it. It's probably there. Get a filter for your tap. Whatever you can do. Right. But we have a lot of old nerd articles and podcasts about water. Staying hydrated is vital. And if you stay hydrated, that's how your body processes this stuff. When you get bugs.
You have all this extra free time, you can go listen to the water podcast.
You can go listen to all the podcasts, yeah. I expect to see our numbers jump up this week with everybody listening to me. The next thing I'm going to do this a little backwards. The next thing is sleep. Because if you're a caregiver, you're not sleeping that well to start with.
Yeah, that was pretty funny that you said sleep.
Yeah, so I wanted to throw that. I have not slept well.
I'm an excellent sleeper.
You have no problem.
When I finally get sleep.
You have no problem sleeping.
I have trouble getting to sleep.
And then I have problems getting her awake. But the problem with being a caregiver is your sleep patterns are all over the place. You may have found a nice groove, and that's great, but if you're a caregiver of someone with Parkinson's or a disease that changes, it's going to be different. And my dad is changing, and I'm having to adjust, and he's having to adjust. And now, throw the anxiety, as I mentioned, I'm having bad dreams about this stuff. It's dealing with it, and now my 87-year-old father is going, What about, and
Uh-huh.
he's worried about it.
And I'm wondering in about a year if there's going to be a whole bunch of dystopian novels about this.
I thought of a short story this morning I was going to write up.
Because I can think of at least 3 of our friends who would write some crazy stories about this.
But, things that can help you is, I'm going to say this, and this kind of an irony on this too, and it'll go into this as well. You got to reduce your anxiety if you're going to sleep.
Mm-hmm.
So one of those things is getting proper rest, is getting rid of the screens right before bed. Turn off the iPad, turn off the phone, do whatever you got to do for like the hour.
Use that warm setting for the evening.
No, turn them off. Don't use them at all. Stay away from the screens. Get a book. Don't read a newspaper.
I read on my device though.
Read a paper book, because the color of light, even the stuff with the filters and everything, will keep your brain amped up. You don't want to be amped up. You want to try to calm down. So play a game with your charge before bed. Read a book. Don't read the newspaper. Don't do things like go and look at social media. And really, that's my next thing too. And I get the irony of talking about social media. I can't see that.
You don't have glasses.
I don't have my glasses on. Hold on. Sorry, guys. Hang on. We're not used to.
Helpful.
We're not going to edit this.
Markers are having trouble.
So you get to see all this. Let's see what do you got there. Oh, okay. Do you want to?
I'm just keeping time.
Are you getting any?
Do you want to do our top of the hour, quarter of the hour?
We will in just a moment. Yes. I want to finish the social media thing. So it might seem like the social media is a great idea during your isolation, but the problem is that's where all the junk is.
There's a lot of misinformation.
There's a lot of misinformation, and really it's just people complaining and whining and political and nonsense
every day. And
it's going to be worse right now. It's going to be worse tomorrow. Because tomorrow's an election here in Ohio. There's primaries all over the country, so there's a lot of stuff going on. Mm-hmm. So none of this stuff, all this negativity, none of this is going to help you. So I'm going to suggest that you stay away from social media, except
what
those.
What is it you called it in that article? You wrote an article about social media taking a break.
Yeah, disconnecting.
Yeah.
You just disconnect from social media. Go dark. Go unplugged for a little bit. That doesn't mean you don't check the resources that you care about, like ours or a news outlet that you really trust. Mm-hmm. Check those out. That's fine, but don't put it down. Don't be on there. If you look at your phone and it says like more than 3 hours a day or something that you're being inundated by this stuff, put your phone away. I mean, it's just, I don't have any social media up right now. I know we're broadcasting. I have no idea.
The only one I have up is our live broadcast.
I have no idea how many people are watching this. I can't see any of that. I don't want to see that. But
one.
Well, that's enough.
Thank you, one listener.
Well, we'll be doing that. We'll
post this later.
We're gonna post
the
it
middle
later.
Of the day.
It is the middle of the day,
and if everybody read your working remotely thing, they're busy working remotely.
They really are busy working remotely. That's a whole nother topic. If you are working remotely and a caregiver, that's another discussion, and I'll do a couple minutes of that at the end. But if you want to talk to family members or friends, pick up the phone. Mm-hmm. Talk to them directly. The voice will make you feel better.
Or Skype if you want.
No technology.
Why not?
Just pick up the phone and hear their voice. If you want to see them, you have to see them visually, then do the Skype thing. But it's just easier. You can sit anywhere. You can be comfortable. You can't be comfortable looking at a Skype screen. FaceTime maybe because you're holding the phone up.
True.
If you got a FaceTime, that's cool. Skype, I guess, works on the phone too. I've never used it that way, but I get that that's an option. The idea is to try to stay as calm as you can, and if you've got that stuff up, if you've got a screen in front of you, you're going to be tempted to look at it. Mm-hmm. So try to stay away from that. And above all, just kind of hang in there.
And don't let everybody freak you out. Check anything that you find on Facebook. Make sure you're looking that stuff up on a reputable source, because the plumber down the street doesn't necessarily know what's the best CDC numbers for this week.
Ignore the politician posts. Look at the CDC.
Yes.
Your local health department and the CDC are your best resources.
These people are the professionals.
They know what they're talking about. They're scared just like you are. They have families. They're going to give you right information. The American Healthcare Association has a coronavirus thing if you're a caregiver. WHO is a little too big. It's too broad. You're going to want to have local stuff. Leading Age, for example, the Centers for Disease Control, they have a thing about
Leading Age Ohio has it on there?
Yeah, long-term care facilities are having issues too, and they're posting stuff on their own websites. So if you need information about your particular area, if you have someone in a nursing facility. Mm-hmm. Pharmacy, the American Pharmacists Association, I got calls and emails from our pharmacy already saying we are up and running. Please call us before you come pick up your stuff because they're getting inundated by stuff as well.
Also, being that tomorrow is an election day,
Oh.
make sure you take the coronavirus precautions for election day. If you would like to know what those are, I can tell you. According to the Columbus Dispatch
Let's have it.
and Channel 4 NBC, for
Now, be aware, this affects a very small number of people tomorrow.
there are only 37 confirmed cases as of March 15th. But, you know, in these counties, make sure you give a little distance between each other. Try to go at a time when everyone's not so busy.
Avoid noon and first thing in the morning.
Yes.
And right after work. If you can go in those odd hours, you'll get in and get out pretty quickly.
Or,
and remember, it is
go vote today if you can.
Well, be aware. Well, if your area has early voting and it's still available today, then go do that. But remember that most of these are primaries, and it's going to be really quick. There's not going to be a lot on the ballot, so it won't take you very long.
Certain county boards to have curbside voting where you don't have to get out of your car.
So now let's move over to really quickly. Let's talk about how to prepare your house.
Okay.
A little bit. Okay. So if you have neighbors, coordinate with your neighbors that if you're close to them, coordinate with what if someone gets sick? Can we send our kid to your house so they don't get sick? Can we get them tested first? They test negative. We're going to isolate them with an aunt or an uncle who's also, who has not tested for the bug, to make sure that they're not going to get sick. Create an emergency contact list. If there's a problem with your charge, if you're a caregiver and you have someone and they get sick, I'm looking at my dad now on the monitor. It looks like he's still asleep. But what if he suddenly got ill? Now the other thing it's not on this list, but if you are a caregiver and you don't have a life call type device for your patient, get one. It's very minimal cost. If you go through your local agency on aging, they can help you get it for almost nothing, if not free. And that will give you an immediate option. If they get very ill, you can hit that button and you'll have resources right away. Let's see, what else? Choose a room in your house that can be designated as a sick room. If somebody gets sick,
if you need to,
you got to isolate somebody, cordon them off.
I was going to say coordinate.
Well,
quarantine.
You got to coordinate it too.
Coordinate a quarantine.
Coordinate a quarantine. Make sure there's enough space and
Hashtag
access.
coordinated quarantine.
If you only have one bathroom in the house, clean it often. Yes. Like every time someone uses that bathroom, they should be required to Clorox wipe the toilet seat, Clorox wipe the counters. Do that every time. If you're not sharing a bathroom and you have one to make a separate one and you have someone ill in the house,
make sure
no one else uses that
washing
bathroom.
Any cloths with hot water, bleach, putting your sponges in the dishwasher, make sure things are sanitized.
No, I'm going to go a step further. Throw the sponges out.
You can't sanitize in the dishwasher?
You can't sanitize a sponge anyway. It's really not possible. It's too porous.
Really?
Whatever you hear on TV, the math says, think about that. It's these, and even
I just figured it was the heat.
Even a synthetic sponge has all that stuff. You might be able to kill some stuff off, but are you going to get all the way into those pores? Be very careful about that.
I've been to the sponge museum.
Are those not live sponges?
Those are natural sponges.
Yeah, natural
in
sponges,
Springs,
not the same thing. Even synthetic sponges will hold it less.
You can't clean any sponges.
I wouldn't take the chance. I'm sure someone's going to say, yes, you can do this stuff to it. But honestly, anybody in this situation, I would not keep those sponges. Get rid of them, buy other ones. Because they're cheap. They're $1.
Bath poofs are $1 or $2. So
yes.
Use a washcloth, throw it in the bath, in the shower.
Wash the washcloth.
And then put it in the washing machine.
Yep. Keep it in super hot water. Check your water heaters. Make sure that the temperature is high enough that it's, because you can set the temperature on your water heater.
What is a good temperature for a water heater?
I think they're typically 125. Why don't you look that up? That would be a good one to find out, because there's got to be a resource. I was always told it's like 125. I think mine is set for that. But I have a hard time getting my dad to wash his hands in hot water. Because his sensory ability is different now, so he perceives heat and cold.
According to this, the recommended hot water heater setting is 120 for most people.
Okay.
But you can set if it hasn't been adjusted, it's most likely set to 140, which is the manufacturer default.
They come at 140, right? That much I knew.
I thought it was 125.
I think 125 is probably
that's reasonable.
A safe.
It's a little bit higher than the
remember that boiling point of water is 100.
But according to OSHA, it says 140. So there's apparently some discrepancy.
Well, I'm going to say this outright. OSHA does some stuff that's dumb. So I wouldn't really.
120 is to reduce your electricity consumption. So I would say 125 seems reasonable.
125 is probably okay. I'm pretty sure that's where
We're
mine
not
is set.
HVAC people, but
It's warm enough what my brother is, and I've had to help him work on those things before, and I always remember we keep them at 125.
all
So,
right, that sounds reasonable.
so again, it's about electricity use and like that.
We have an issue with hot water with your father being able to feel.
Yeah, he can't really
heat,
tell, but
so-
we have to be able to wash his hands in hot water. That's a whole nother mission, a whole nother issue there. So, the other thing is, if you find out that someone in your area has this bug, don't freak out. Be calm. And there's more to it than just someone having it and spreading it around. You know how hard it is to get. We ran out of time on the Facebook Live.
According to this, 140 degrees is what kills bacteria. Oh, I didn't realize there was a time limit. It's still running.
Says it failed.
Oh, we'll have to start over.
I'm gonna start it up again.
Pause.
It's uploading. Did you pause our recording? Use good.
Okay, I just started recording again. So can we go through that again?
Yeah. So what were you?
Hot water.
Bacterial hot water.
Okay, the temperature to kill bacteria with hot water heaters is 140,
Okay.
according to my resources.
Okay. So be careful. What is your resource? We need to cite that.
Oh, I just said. What was it? Energy something.org.
Probably energy.org or one of those guys. Because it's more about, people think about it more about electricity than and electrical use and saving money than they do about the danger of not washing your hands. But we have a lot of things going on with this, so we have to be really careful.
Yes.
The other thing to think of, I'm going to backstep because one thing I forgot to mention was was talking about social media, but I skipped
It
a
was
piece.
waterheatertimer.org, sorry.
Oh, waterheater
Timer.org.
timer.org. Okay. So I'm going to back this up. One of the ways of dealing with this isolation, I talked about sleep and food differences and things like that that can alter your health while you're doing this.
Mm-hmm.
Don't forget about exercise.
Yeah.
With the gyms closed and everything else, there are lots of things. And you mentioned bicycling a little while ago.
We also
Cycling-
have a Wii Fit balance board. So
Well,
can
yeah,
use
if
that.
you've got something like that so you can keep moving. But I would recommend going outside.
Yes.
If at all possible, just take a walk. Do anything like that. Get your
What is
cardio.
it they say? Blow the dust off of you?
You need to get your cardio up because that will help you deal with stress.
Well,
Your
it's
blood.
also good to get outside and get some cold on you to kill him.
Well, it may not. I don't know that that's going to help, but it's the idea is that you need to get your heart rate up. You need to move around. You need to walk. You need to run. You need to do other stuff. Do something very active.
Well, being out in nature is also good for your blood pressure.
It will It'll help you calm down, but just you need to move around. If you can do yoga, that'll help you. If you can meditate, that'll help you. Anything to help you keep calm and avoid contact with others, but open air is always good for you.
Mm-hmm.
So try to do something to get your heart rate up. And you mentioned cycling, and cycling is one of those things you don't need to have other people for. You
You
don't
can
need.
take the dog for a walk, or just go to the park by yourself. There are a lot of things you can do outside.
I don't know that I would go to.
alone.
I don't know that I'd go to the park unless you make sure you don't touch any surfaces. Just
Well,
stay
no,
away
well,
from
just
stuff.
stay on the
Just
path.
walk around. Leave
Don't
stuff
rub
alone.
up against the benches.
Trash cans can be just a breeding ground for this stuff, so be very careful about that. But go outside, move around a little bit. Now, if you can't do that, the streaming services, we talked about Netflix and everything, the streaming services have lots of free exercise
They
programs.
do. Amazon especially.
Amazon's
has
got
many
them,
videos.
Netflix has got them, everybody's got them, and there are even free channels for Roku that have them on there.
Mm-hmm.
So find something you like, a yoga thing or something, anything to get your heart rate up or to calm it down in other ways, to stay calm and sort of let go of some of the stress.
Just to mention in this part too, if you just joined us, if you have any questions, feel free to comment them. I'm watching the Facebook live stream. So
Yeah, we've got the
if you
stream
have a
up.
comment or something, we can attest to that, or just say hi.
And we'll do as this thing progresses, we'll probably do another one of these. So now that you've seen it, you'll know kind of what it looks like. But I think this kind of discussion is really important because we're not talking heads on some news show.
No.
We have no political agenda. This is entirely for you to help you with, and it helps us too. We're forced to stay ahead of this.
Mm-hmm.
And there are every day, we keep talking about the coronavirus, but this stuff carries over to preventing the flu.
Yeah. I have found a checklist for household plan of action. If
Oh,
you would
let's
like
have
to
that.
see what's on that.
Sure, fire away.
Okay.
Where is it you're looking?
Preventative actions. This is from cdc.gov. Prepare checklist household readiness. Get a household plan of action. Consider the members of your household at greatest risk, such as older people or people with chronic severe illnesses.
Okay.
Ask your neighbors what their plan is, as you said. Use your support systems. Contact any local organizations, I would say Council on Aging, things like that, for support and resources. That's what they're there for. Create an emergency contact list of friends and family and neighbors in case you need them. Choose a room in your house to be a sick room. You already said that. Wash your hands frequently. Preventative actions. Avoid touching your eyes, nose, and mouth. Stay home if you're sick. And stay away from the people with the immune suppression, if you can, please. Cover your cough or sneeze with a tissue. Throw the tissue away. Clean and disinfect any surfaces that have been touched. Prepare your child for school and child care. Be prepared if your child's school or child care is temporarily dismissed for potential changes at your workplace. Prepare to work from home. We have a whole video on that if you would like to watch that.
That's at gldenterprises.net.
It's on our YouTube channel as well.
Yep.
In case of an outbreak in your community, you would like to look for warning signs of COVID-19. There's difficulty breathing, persistent pain in your chest, new confusion or inability to wake up or arouse person, blue lips or face. Keep away from other people who are sick. Stay home if you are ill and you have a fever or cough. Those are the first, I would imagine those are the first two.
Well, it said that fever is one of the most noticeable pieces of this thing. You'll generally feel bad. And one lady described it as feeling like there were knives in all her muscles.
Oh, that sounds horrible.
So it sounds like the flu, like
Okay.
they're really bad.
Just
I
achy,
remember having,
horrible. Ugh.
I remember having what I think they called the Asian flu back in the 70s. I was in the 5th grade.
Okay.
And I was down for more than a week.
Is that like
It was bad.
the bird flu?
It wasn't like bird
No?
flu. I mean, it may be related. I don't know,
I
but
don't
it
know.
didn't. I didn't really.
I think I'm just mixing up Asian and aviary.
It's a lot of flu. Yeah, there's a lot of bad stuff.
Asian and aviary are close words for my brain.
But I had I remember that most of it was. It started with me throwing up on the school bus on the way home.
Oh no.
And then I was done for the week.
I have such a fear of throwing up in public. It's like a weird embarrassment.
Well,
Can you?
I don't know what this. I didn't see the thing about what this does to your stomach, but this is a respiratory virus, so it's probably not. It's probably not something that you're going to have a lot of stomach issues
a lot of
with.
Stomach stuff. It
No,
says
this seems like
stay at least 6 feet away from people if you can.
further.
More than that.
Everybody has been
now.
saying further. That this stuff travels, it's airborne, it's easy enough to get it on somebody just in spittle and talking, and you just got to be really careful.
This is actually an important point. It says take care of your emotional health. That's what we were just talking about. Keep in touch and contact with your household members and your other family members so that you don't lose, connection.
And do
We're
it
social creatures,
which
and
is why
important.
this is why I suggest don't use the computer. Pick up the telephone. Talk to them directly. You'll help each other calm down. This is anxiety from this thing is turning out to be as bad as the disease itself.
Right.
It's causing people to really freak out. We are under the gun here. We're worried about finances. We're worried about our business. I've had a lot of things canceled.
Yes.
I've had a lot of
Everyone's
organizations.
discouraging any public gathering.
All
of our network meetings are canceled.
All that's
from
canceled. We're
several
going
different groups.
We're going electronic in a couple of weeks on all
so
these.
So that's also a choice. If you have to work, consider a Zoom meeting or Skype meetings or FaceTime meetings.
All of these things are free and they're available to you with limitations. But I've done two Zoom meetings today, and one was a group meeting for one of our networks.
Super simple.
It's
wouldn't
very
even
easy.
believe it. So even if you want to contact your family, you can use those video resources.
Use those video resources.
Just because you're not in a business doesn't mean that you can't use those.
Yeah, that stuff's all free.
Conferencing.
Now, I've also read that Zoom and the other companies are upping their game. They're getting more server space. They're getting more.
That was my concern.
More
what
broadband.
if those things crash?
They're not ready for this, and that's what it looks like.
This says make sure you have access to several weeks of your medications, and you said the pharmacy already called you.
Pharmacy's already called me. I have approximately 2 weeks of stuff for
But
Dad.
You keep 2 weeks. Anyway.
I'm usually 2 weeks out anyway because as soon as it's available, I get it and refill it because I don't want to be without if something happens.
Well, most people on maintenance medications keep those. My parents get theirs through one of the mail order prescriptions. They're usually about a month ahead.
Right. And some medication
and you have
they won't.
To be because it takes them a week to mail it to you.
Some of this medication they won't let you do that. Right. So it's like his Parkinson's med, which we're adjusting now. It's become that's part of the sleep issue. But those kind of things you got to stay on top of that stuff.
If you are going to go out in public, don't touch anything more than you need to.
Driving gloves won't help you.
No.
Work gloves won't help you. I mean, they will. There's a
Just
barrier
wash your
there for
hands
sure,
after
but
you've been out
wash
in
your
public.
hands. It's that simple.
Sanitize your hands. Sanitize a shopping cart.
Everything. Now, I'm gonna throw a monkey wrench into that.
Uh-oh.
Every piece of information I'm seeing from health professionals, I'm not going to quote them.
Doesn't help.
No, they say definitely you can use it, but nothing is better than washing your hands.
Yeah.
The water, the soap, the combination of those. If you buy this new soap I've got for you today, you buy this new soap, just add water, and you get suds absolutely free.
There's a really good point as to if you buy this, and don't fall for people who are selling things on Facebook Marketplace at 3 times their value.
Usually
soap and water's fine. You don't have to scour the world for
Facebook
hand
has been
sanitizer.
really good about dumping those people. So be very careful about
good.
this.
Are they dropping them off?
Yeah, there's a lot of scams going on.
Yeah.
You got to report them though, because they can't watch for everything.
Mm-hmm.
So if you see something like that, report it. Let Facebook take care of it. But I'm looking at Facebook right now, and we're broadcasting, so that's making me think of it.
Mm-hmm.
But it isn't just Facebook. Phone calls are starting.
Yeah.
The elderly are being targeted again, as if they weren't already in the tax season. They're being targeted for other things. So watch out for that stuff if you're a caregiver. We're beating this in the ground, but be careful. Just be careful, and please stay calm.
Well, you know what? Just use your brain. Use reasonable precautions.
Well, the problem is that
would be
we're
more
getting
so than you usually do.
We're getting conflicted information. So I'm going to read you a few quotes. These are by a couple of different doctors, but I think the ones I've got here are the same ones.
Okay.
We asked them. There's an article on adviceshinetext.com, and it's an advice network, and they were asking people. They asked experts how to cope with the coronavirus anxiety.
Okay.
Now, I'm going to talk about this only in the aspect of
CVA, coronavirus anxiety.
Does it have a thing already?
I don't know.
I don't.
Everything needs.
Don't
shortened.
bet on it. It's going to have an acronym.
Everything needs shortened.
It already has a logo
Hashtag
and
CVA.
a theme song. It's like when we have a
theme
war, the
song?
first thing you got to do is logo and
I'm
a theme
sorry,
song.
there's a theme song.
I think there was. They play that.
Who
dun,
would
dun,
want to
dun, 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 dun.
volunteer? That's just.
Let's do the theme
dramatic news song.
song. It is a dramatic news song. So they have all this stuff, but they asked all these questions of these experts to try to get some information. So they went to an associate professor of medicine at Northwestern, and her name is Catherine Belling. Mm-hmm. And they asked her some of these questions. So they need, before you get conflicting information that's out there, find some reputable organization. And Dr. Belling says, people who are already predisposed to general anxiety, and she's including herself in that, need to find a single source of reliable information that's not falsely reassuring. That's why I recommended the CDC.
Well, you know what I just found on the CDC, which is interesting? Under their frequently asked questions, it says, who could someone blame or avoid to avoid COVID-19? Like, who's at fault? So now we're blaming people for biological viruses?
No, they're talking about the political side of this.
Yeah.
That's why you got to be careful about that
Don't
stuff.
let
Look at the
social
science.
stigma hurt people. Even the CDC says don't create more anger or fear towards ordinary people because the disease is the problem, not some group of people.
So at this point, your local health department is probably one of the best sources, but I'm going to caution you on that. Don't take the public relations officer's information as black and white. Mm-hmm. Make sure that you understand that the experts are giving those things to get out because that's their job, is to distribute that information. So be mindful of that. But they're still the best source of information because they're going to know what's going on in your area.
Well, I think it's interesting somebody's trying to find someone to blame. No one ever tries to figure out where the flu came from.
Well, it's been around too long.
Oh.
And this is not a new thing. Coronavirus isn't new.
And
this
also,
strain,
coronaviruses are a class
are a
of
class
viruses.
of virus. This is a strain. The COVID-19 is the thing. So be careful and remember what you can control here. What is it? The Serenity Prayer? Something about
change the things that can change and the wisdom to know the difference between the things that you can and cannot
right.
change.
So it's not realistic to hunker down and cut yourself off from everything because you just can't. Your world's going to stop. The most control we have, this is, again, Dr. Belling, the most control we have is basic, unspectacular hygiene and being patient. And I think the patience is really where we're losing it. Continue a mindful practice. If you feel like your anxiety is creeping in, try not to make it your cue to, go bananas.
Yeah.
Do some mindful techniques until you get grounded.
Well, and keep in mind, this is a person-to-person respiratory droplets. It's not, rubbing up against someone's grocery store. You're not going to be like, oh my God, I have it now.
Not likely.
No.
It's possible.
Unless
but
they're covered in respiratory droplets.
They're sneezing on you or coughing on you or something.
That's a little different.
Yeah. This is another resource. This Dr. Crystal Lewis is quoted in here as well. Says you must take care of yourself first so that you can continue to take care of your loved ones.
We say that all the time.
Yes. So this is
the airplane thing.
This is the airplane safety mentality. If you don't look after yourself, you will not be here to take care of your family members. So please, whatever you think is more important for them, it is more important for you. Set boundaries with your phone about looking at your phone. Remember to go to johnhartford.com or John A. Yeah, it's got an A.
JohnAHartford.org.
.org.
There's a lot of good resources.
There's
there.
so many pieces in there. Get those moments of hope. Don't forget your empathy. Remember that you don't know what other people are going through. I read something today that really kind of ticked me off. I'm looking at a story that was posted on Facebook by one of the news outlets.
Okay.
And some idiot posted on there, do any of you know someone who has this or even has tested positive for it? Isn't it funny that nobody knows anyone who does? And that's crap. Mm-hmm. Like, okay.
Well, if there's 30 people in Ohio that have it, I don't know.
I'm not going to know all those people.
I don't know all whatever million people that live
Their
in
point
Ohio.
was that this is a conspiracy of some kind that
Really?
the government's doing so that they can nationalize the government.
Is this person also a flat earther?
Well, I'm wondering about that because yes, they have blown this out of whack. We get it. But there's a reason for the blowing out of whack. I don't agree with all of them, and nobody should. That's why we have elections.
Yes.
But this is the better safe than sorry mentality, and if it causes people a little bit of financial heartache, we'll have to deal with it. We'll make it work somehow. Everybody will be okay. And it is going to be very, very hard. And you're not by yourself.
Right.
This is...
Well, you know what I think would probably be a good way to wrap this up? Do you have something else?
No, I'm good. That's pretty good.
On Google today, do the 5 to help stop coronavirus. Hands, wash hands often. Elbow, cough into your elbow or into a tissue and throw it away, please.
Yep.
Face, don't touch your hands, face, mouth, nose after touching other infected things. Feet, stay more than 3 feet. We're saying at least 6 feet apart.
Well, it says 6 feet. I'm going to go longer than that. I'm going to say at least 8 feet.
And feel. If you feel sick, stay away from people, please. So hands, elbows, face, feet, and feel. Most of those are body parts. Oh, we're ringing.
Keep going.
Da-na-na-na. Our Facebook Live camera is now a phone, so we have to wait a second.
It's up. We're running.
There we go. The live videos. So just keep those things in mind. Your hands, cough. Don't cough on people. Cough into a tissue or your elbow. Don't touch your face, nose, mouth. Stay more than 6 feet away from people. And if you feel sick, stay away from other people, please.
So I'm gonna end this. You said we needed something a little lighthearted in this, and I didn't feel.
I said, could we have jokes? And
She
you
said
no.
And I typically do that. I do some kind of joke at the beginning of our podcast. I didn't think it was right, but I'm going to end this with something that's not quite a joke, but it's funny and ironic.
Okay.
This is the 42nd anniversary of the Douglas Adams radio broadcast of Hitchhiker's Guide to the Galaxy. And if you don't know anything about this, it's a satire. Mm-hmm. It's all about government and dumb things, and it's set in outer space.
Right.
And it's about this poor guy who...
He's losing his house.
He wakes up in the morning.
Intergalactic highways.
They're putting a highway through, and through
the
his
entire planet.
No,
Earth.
hang on. They're putting a highway through his neighborhood, and he wakes up in the morning to bulldozers, and then he finds out his best friends from another planet, and they're actually putting a highway through our star system.
Well, that's right.
They're going to knock down the Earth too. He gets rescued, but they give you throughout the story. They give you these pieces from the Hitchhiker's Guide to the Galaxy, this reference book. Mm-hmm. And this is how Earth got started, but this is a long, detailed thing. But this will tell you what it is.
So nerdy.
These tales of impending doom allowed the Golga Frenchums to rid themselves of an entire useless third of their population. They sent aloft 3 arcs. The B arc would hold everyone else.
That's arc, A-R-K?
A-R-K.
Okay.
Such as hairdressers and telephone sanitizers. They sent the B ship off first. But of course, the other 2/3 of the population stayed on the planet and lived full, rich and happy lives. They were trying to rid themselves of the useless third of their population.
Ouch.
Now wait, until those people who stayed behind, thinking they were getting rid of all the people that didn't matter,
They needed telephone hand sanitizer.
were all wiped out by a virulent disease contracted from a dirty telephone. Wipe
didn't
your
think
phones down, people.
They didn't think you needed telephone sanitizer.
Clean your phones.
Yes.
So here's the other piece that Douglas Adams said that I'm going to quote, because I had the honor of meeting Douglas, and he was such a good writer and such an ironic guy. But one thing I'm going to give you 2 words to live by during all of this. Don't panic. It's the most helpful or intelligible thing anybody ever said to me. It pops up on my phone every time it rings.
That is his screensaver.
It is my screenshot.
That is legit.
It's my
Not
lock
kidding.
screen. And I need you guys, everybody out there, to be calm. Take care of your family member. Take care of your child. Take care of whoever it is you're taking care of. But first, take care of yourself. You're not going to be able to help anybody if you don't. Go buy all this stuff. Have a look at it. All this information is out there. Send us an email if you want some information. You can't find it, we'll try to help you find it.
oldnerdfitness@gmail.com.
Yep. And
We will
or
post
Facebook.
a bunch of links.
Send it to Facebook if you want to do it that way. Or if you got questions, send those on our Facebook page. We're happy to answer them there. And if we don't know the answers, we will find them. Again, we are not medical professionals. We just find the information to help you to
We're just sharing what we
ride this out. We will be back again within the next couple of weeks to do another one of these. We may do a couple of these a week because this is an important thing. And if you are new to working at home, if that's something you're doing, go to our website, gldenterprises.net. There's resources there to help you with that. And it also talks a little bit about the virus. So get out there, be careful, be safe. If we're not gonna be able
maybe
to,
not get up. And
we're
get
not gonna
out
be able
there.
to get up.
Get up and stay.
Get
home.
up and stay home.
Get up and get out there in your own bubble.
Yeah, stay in your
Get
bubble.
outside.
Go
How about
outside.
that? Take a walk.
And hopefully we'll all weather this. It's all going to be okay. Try to hang in there. And nobody's more worried than we are. So we're all in it with you. And I know lots of people have been reaching out to me. Hey, is your dad okay? Are you okay? Your family okay?
Please share this out to people you know or caregivers. Or if you guys have questions, comment on the video, comment on the blogs, whatever you want.
Yes.
We want this to be interactive.
Send this out. And we appreciate it. So we're going to sign off for now, and hopefully we've had enough time on Facebook, and everybody will
stay healthy. Get up and stay healthy.
Get up and stay healthy, stay safe, and don't give in to the crazy. Relax, stay calm. Again, in Douglas's words, don't panic. We'll see you soon.